episode number 293 of the Wholesome Fertility Podcast. My guest today is Dr. Armando Hernandez-Rey. Dr. Hernandez-Rey is Conceptions Florida's medical director and triple board certified in reproductive endocrinology and infertility, obstetrics and gynecology, and surgery. Dr. Hernandez-Rey has over 24 years of experience in the medical field. He specializes in treating patients with polycystic ovary syndrome, recurrent pregnancy loss, and severe endometriosis. He is especially interested in fertility preservation, such as egg freezing for patients who must delay childbearing for personal or medical reasons, including cancer and systemic lupus erythematosus. Dr. Hernandez-Rey is an assistant clinical professor at the Herbert Wertheim College of Medicine at Florida International University and serves as an ad hoc reviewer for the prestigious peer-reviewed journal Fertility and Sterility. He has also published several articles and chapters in medical literature. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. Welcome to the Wholesome Fertility Podcast, a space where you can find empowerment on your fertility journey. I'm your host, Michelle Orovitz, and I wanted to pop in before we get started to mention that if you haven't already heard, I've released my new book, The Way of Fertility, that has been created for those who have tried everything to conceive and are simply unsure of what else they can do. This book shares tried and true wisdom from ancient teachings along with modern research that supports much of what has been taught for centuries. It has been made with love, and the stories shared will serve to awaken hope within you. If you'd like to give it a test drive, I offer the first chapter for free, and you can find a link with more information in the episode notes. I would also like to extend an invitation to you as part of our beautiful community to share your thoughts and experiences by leaving a review of the podcast. Your words have incredible power to inspire others who are also seeking comfort on their fertility journey. And for anyone who has already left a review, thank you from the bottom of my heart. Welcome to the podcast, Dr. Hernandez-Rey.
Thank you, Michelle. Thanks for the invitation. It's really an honor and a privilege to be on your show, on your podcast.
Yes. Well, I've heard a lot about you over the years because I've had a lot of patients go to you. And one of the things that I've heard is that you do really well with surgeries and fibroids, and you're able to really go surgically in and remove fibroids, but in a way that still preserves fertility. So that was one of the things that I've learned.
Well, reproductive endocrinology and fertility as a subspecialty is a surgical subspecialty, as is OBGYN, which is a mandatory path to get to the infertility route. Unfortunately, a lot of the newer generation is not operating, and because they're not taught, not through no fault of their own, they're not taught. The reality is that it is for a myriad of reasons this phenomenon has happened. Number one, the minimally invasive surgery tract has been developed, where you have the person who's really perfected their obstetrical skills, and then you have the gynecologic oncology route and the pelvic urogynecology or pelvic reconstruction route, and the minimally invasive surgical route. And a lot of the reproductive endocrinologists have said, you know what, I'm going to forego surgery and I'm going to refer it out. My personal philosophy, and this is in no way critical to absolutely anybody, it's just my own, is that I went into medicine to be a surgeon. I actually wanted to be an orthopedic surgeon. Ended up not liking it. I had a very bad fracture when I was in my teens playing competitive soccer, and I really had some PTSD from that fracture. So I just couldn't see myself doing orthopedic surgery, but I somehow found my way towards OBGYN, absolutely loved it, and eventually towards the reproductive endocrinology route, which encompasses a lot of surgery should you allow it. And so, yes, like you said, fibroids are an important part of fertility. Reconstruction used to be much more important than it is now. People are bypassing that route and going directly to in vitro fertilization. Endometriosis, as I said, I was running a little bit late today. I was in a very, very complex endometriosis case with a patient with bilateral endometriomas and complete frozen pelvis and scar tissue. And, just a little bit longer, had to work with the colorectal surgeons to do some uh, resection of the colon because it was, endometriosis is such an awful, awful disease. So,
Yeah.
yes, to answer your question, I absolutely love surgery. I think it's an integral part of the infertility journey to get a patient from being infertile to getting them to a high level of success with any sort of treatment. And hopefully it's more conservative than having to resort to artificial insemination or in vitro. And with just surgery and corrective surgery, we can help the couple achieve a pregnancy.
Yeah, and I think it's important because I think that a lot of people might not realize that there's certain people that specialize in this or have experience doing that, doing surgery and really getting in there because it is important to find somebody who's specialized if you have a complicated case.
I think it's important. I think people feel uh, well taken care of. Again, my perception, people feel well taken care of when everything is done in-house, meaning,
Hmm.
there's no messages that are get lost as you refer a patient out who the may have the minimally invasive surgery knowledge, but not necessarily the focus on infertility and a reproductive endocrinology specialist has.
Yeah,
And I think people
absolutely.
feel
Because
comfortable with that.
there's some people that will take out fibroids, but they're not doing it with fertility in mind. For many women,
Correct.
it could just be just taking out fibroids, but you're doing these things with fertility in mind.
Look, there are many great surgeons out there that are not infertility specialists. I want to make sure that I'm clear. I
Yeah.
just think if I always love surgery. I happen to do surgery, and I feel my patients feel very comfortable with me doing the surgery and not being referred out. Is what I
Yeah.
is what I think. The infertility journey is very complex. It requires a lot of a woman, in particular, more than the male, and to be, passed around. Um, it gets complicated, and I
Right.
think it's nice to be able to offer that service to patients.
Yeah, for sure. And then you do specialize in miscarriages.
Sure. I mean, I think we all really have a focus on as we're all specialized in miscarriages and PCOS and all that. There's some people that tend to see more miscarriage patients, or people will refer miscarriage patients to us. Um, we have a particular kind of focus on that. I think a lot of it is genetic, a lot of it is immunologic,
Hmm.
a lot of it is just taking a holistic approach to things and not just focusing on one or the more common causes of infertility. And even now, I think that the use of supplements, which maybe 15 years ago was maybe considered some snake oil, now I think there's a lot of provocative data that has shown that supplements do work, in particular in cases with recurrent miscarriage. Um, and now we have the ability to measure those levels, and we are now ability to supplement those levels, and they have tremendous impact positively on these patients.
And what supplements have you seen help with miscarriages?
Well, I think a lot of it has to do with what the cause of the miscarriage is.
Hmm.
Oftentimes, believe it or not, miscarriages can be. You alluded to fibroids. It could be anatomical.
Hmm.
Submucosal myoma. Well, there's not going to be any supplement that's going to help with that. It's just purely
Right.
the surgical route, or you know, uh, the diminished ovarian reserve cause for recurrent miscarriages, which is older women or ovaries that are behaving or eggs that are behaving older than what their chronological age would dictate. You have a higher chance for aneuploidy. And in those cases, there's a veritable cocktail of supplements that we use, including ubiquinol, including
Hmm.
N-acetylcysteine, including vitamin E, even melatonin has been shown
Hmm.
to be very, very effective. And I can go on and on, even alpha lipoic acid as
Yeah.
well. There's some very nice studies coming out of Mayo Clinic that have shown that alpha lipoic acid is very, very good for recurrent miscarriages. So again, things that we thought were, well, they can't
Right.
hurt. Now we know that they absolutely help.
Right. Yeah. I mean, that's great because it helps to know that there's something that people can do that really does make a difference, and it's not just like in theory. With miscarriages, when it comes to immunology, I'd love
Hmm.
to talk about that because I know that that's a big one. Actually, I did see a study that showed that women who have are more sexually active, that their immune system calms down, it behaves differently in the luteal phase so that it's able to receive life so that it's not seeing like the sperm as an invader. The
So women
Yeah.
that are more sexually active than others, it's probably a function of repeated antigen exposure, which is the more the woman is exposed to the antigens of the sperm,
Hmm.
more there becomes an acquiescence by the immune system to be more acceptive of that embryo. Because remember, the embryo is a haplotype, meaning it's half half female, half the woman, half the mother, and half the male. And the only genes that the immune system of the mother is gonna harbor the pregnancy are her own. And
Hmm.
so oftentimes the
Right.
immunologic processes are heightened because it does not recognize the male antigens that are form part of the embryo in general. As a whole, I mean, recurrent pregnancy loss is is a small portion of the general population, and it's skewed towards advanced maternal age and advanced paternal age. So the immunologic component, absolutely important. I think it's the one where we're still not 100% sure how to absolutely treat it, although supplementation and uh, sub, immune suppression definitely are known to work. It's the testing that I think we still need a lot more work in doing because people talk about NK cells, and that was part of my thesis when I was a fellow. So we talk about NK cells and ANA and antiphospholipids and all of that, and the reality is that these tests have very, very poor sensitivity
Hmm.
in the realm of immunologic fertility or reproductive immunology. And so you may have COVID and then you can test positive or lightly positive for NK cells. And so I think the overwhelming response by the treating physician is, well, they're positive, they must be immunologically incapable of handling a pregnancy, so therefore we should treat with nowadays what we use as intralipids. Back in the day, we used to use IVIG. That has kind of fallen by the wayside a little bit. I think it's better to treat empirically than
Hmm.
to have someone treat or test for all of these different immune markers that really in the presence of immunology and reproductive immunology, they have very low sensitivity. Now, if you're looking for lupus or rheumatoid arthritis or mixed collagen disorder or Sjogren's, for sure, they are your go-tos every single time.
And what about PRP for ovaries? What has
Uh,
do you offer that?
Ovaries, American Society of Reproductive Medicine came out with a black box warning that they do not recommend PRP for ovaries
Oh,
for
okay.
ovaries. Now, for PRP for recurrent implantation failure,
Hmm.
um, poor lining development, there is some very robust data that there may be some room and benefit for this, and we do offer that.
Oh,
We do not
okay.
offer intra-ovarian PRP because ASRM has a huge black box warning on this. It's a liability. The,
Oh,
the,
okay.
the
I didn't know that.
potential for infection is there.
Hmm.
Um, Tubal ovarian abscess have been reported. Adhesions, periovarian adhesions, with very little to no benefit whatsoever.
Okay, got
I
it.
mean, the whole premise for it is that we are regenerating the follicle complex and therefore improving egg quality, and that definitively has not been shown to be the case.
Got
Although
it.
anybody who suffers from that, as I would be like, sign me up.
Right.
But unfortunately, it's very easy for us to fall prey to things that we desperately want without having the medical literature to corroborate it or back it up.
Got it. So that's not, so that's actually showing to not necessarily be what a lot of people originally thought, but for the uterus, it has been
Yes,
shown to help.
we are doing PRP installations in very select group of women with those diagnoses in particular, and
So who would
have,
be a good candidate? Somebody who's had failed transfers,
yes, someone with very
inflammation.
high quality embryos that are not getting pregnant. Also, patients, for example, patients who have adenomyosis
Hmm.
that do not develop a nice lining, a thickened lining.
Hmm.
Those have been shown. Our numbers are very small. By no means they are in the realm of what a randomized controlled trial should be. We're following the data from the randomized controlled trials and from the literature that's out there. So patients with adenomyosis who have poor lining development, current implantation failure, so patients with euploid embryos, that means a normal embryo that's tested that looks to be high quality. After a second implantation failure, we'll offer that to the patient
Hmm.
as a
Got it.
possibility.
Awesome. And then also we were talking about Ozempic pre-talk. So I'd
The the
love
uh,
to get
the
your,
topic du jour these days, right?
yes, yep, Ozempic babies.
That's right. So as we were discussing, I mean, this phenomena is not really a phenomena that's surprising at all. It is just a byproduct, a side effect of of how the medication works and the positive effects that it have on women with, in particular, anovulatory disorders, specifically polycystic ovarian syndrome, which is often tied to or associated with insulin resistance,
Hmm.
obesity, sometimes even overt type 2 diabetes,
Hmm.
and the elevated levels of insulin, the elevated testosterone levels, they all work together to create this sort of environment within the ovary and within the system of the female, which creates an anovulatory disorder or dysfunction. And as a woman loses weight by virtue of the way that these GLP-1s or glucagon-like peptides work, they're very successful. They're very good at, number one, slowing gastric emptying, which in turn slows down the release of sugar into the blood system. To the number one, number two, it stops the release of glucose produced by the liver, and number three, increases insulin levels. So increased insulin levels helps get the sugar into the muscles, out of the circulation, and out of stimulating the ovaries and the theca cells to produce more androgens, which then produce more estrogen, which then stops the hypothalamic pituitary ovarian axis from functioning correctly. And as these levels drop, patients automatically begin to have spontaneous ovulation. If the system is working and the male has normal sperm and they're sexually active, this is how the Ozempic baby phenomena occurs. And what we discussed also is that the concern is of the downstream consequences of Ozempic babies, given that the current recommendations are to have at least a 2 month washout period
Hmm.
before anybody starts to try to conceive.
So 2 month washout means like really not trying anything.
No exposure, right? No exposure.
Yeah. And then also, I know like naturally, myoinositol is really helpful as well for insulin resistance. It might take a little longer. And then also, metformin has been
Yeah.
used as well.
Yes. Myoinositol is a great product. Myoinositol alone, although you will find oftentimes myoinositol with a D-chimeric
Right.
ositol,
Yeah.
and really the literature shows that myoinositol by itself is the one that truly has the most benefit. Might be
Right.
hard to
Because
find.
for a little while they said myoinositol and D-chiro, but now they're going back to saying just myoinositol.
Yeah, well,
Correct?
the way that it's normally found in the body is at a ratio of 20 to 1, and
Hmm.
that's what those supplements show, 20 to 1. Although we know now that in the ovary, it's almost 40 to 1
Hmm.
ratio of myoinositol to D-chimeric ositol. So, or inositol. I'm sorry, inositol.
Hmm.
myo-inositol is actually not an essential vitamin, but it's considered like a vitamin. It's in the category of B8.
Mm-hmm.
Um, it's a glucose-like peptide that basically helps to help the system function by processing the circulating blood sugar in a way that's more physiologic, and
Mm-hmm.
thereby lowering insulin levels, and thereby also helping tremendously with regularity of cycles and even spontaneous ovulation as well. And metformin obviously is a medication that's been around for many, many years. Uh, it is somewhat of a controversial drug.
Mm-hmm.
Um, it is it is an anti-aging drug even these days, because we know that insulin levels are so profoundly toxic for aging, for the muscle, and for the system in general.
Mm-hmm.
And but so we know it works. We know that it helps with the the efficiency uh, of insulin, and so it's certainly been used for many, many, many years in the presence of patients with polycystic ovarian syndrome. I would challenge people to be a little bit more meticulous about using it in patients who are the lean PCOS
Right.
or the skinny PCOS or the ovulatory PCOS, even though insulin levels have been shown to be higher,
So
slightly
you're
higher
talking
in
about being cautious with metformin, not
met.
necessarily myo-inositol.
No, with metformin.
Yeah,
With
yeah.
metformin, you also don't want very high levels of myo-inositol because
Mm-hmm.
they can be, there is some quote unquote toxicity.
Mm-hmm.
I think the recommendations are up to 4 grams per day. I think no,
Mm-hmm.
the recommendations are 4 grams per day in
Mm-hmm.
two divided doses, 2 grams in the morning and 2 grams at night.
Mm-hmm.
Um, I've seen patients be on 8 grams and 10 grams, and toxicity really starts happening around the greater than 10 gram dose.
Mm-hmm.
In our office, we only use it, what's recommended, which is the 4 gram total per day, 2 grams in the morning, 2 grams at night. I don't think it's the end all be all. I don't think it's, treating anything in life is multi pronged. It's not just one
Yep.
single thing, perhaps.
Right. Right.
But I definitely believe very wholeheartedly that it does assist in adjunct treatment. Although we certainly have put patients on myo-inositol and combined with diet and exercising have been able to achieve pregnancies on their own, which is obviously what we want instead of having to go through treatments.
That's great. I mean, I will say that I was very surprised this past year. Two different patients came from different different places, not yours. It was other doctors, but I think the nutritionist there suggested metformin when they did not have insulin resistance or PCOS for egg quality.
Yeah, I'm not familiar with any studies that have shown that have improved that. In fact, when I was a fellow, we were just as I was coming into fellowship, where I trained, Rutgers was involved with a very well known and publicized study. It's called the PPCOS study, which looked at patients on placebo versus metformin alone versus metformin with Clomid. Sorry, placebo versus Clomid with metformin, and there was no difference in pregnancy rates or
Hmm.
anything else. I'll go one step further with going back to the myo-inositol. It has even been shown to decrease the rates of gestational diabetes.
Hmm.
And so, in our patients with PCOS, with who are, you know, stage one, type one obesity, type two, we'll continue them on the myo-inositol throughout the pregnancy. And when they leave us and go to their OBGYN, in our referral letter back, we'll say that we're recommending for her to continue on myo-inositol
Yeah. Oh, that's
because there have
that's
been improvements
good to know.
in sugar levels and glycemic control and reduction in gestational diabetes overall.
Another big one is vitamin D. A lot of people, even though we're in Florida here, we have a lot of sun. A lot of people are very deficient in
Yeah.
vitamin D.
What it is a combination of things. Number one, we're not as sun exposed as you think we are.
Hmm.
You know, um, we're always in a car, we're always indoors, it's very hot. And yes, we go out to the beach and there is a lot of sun, but we become very, very sensitive um, to the sun and to the effect, the untoward effects of the sun. So we protect ourselves tremendously. That's number one.
Hmm.
Number two is that I think the levels are set higher than what the average person can can sustain with just diet and sun exposure.
Mhm.
And actually the recommendations now in the infertility world, that when you order a vitamin D from Quest, they'll tell you that the levels are, you want them definitively above 20,
Mhm.
certainly above 30, and now recently now the recommendations are them for them to go above 40.
Yes. Yep. I've been hearing that,
And
or
and
even
and and
50. Yeah.
yeah, I'm not. Yeah, so I heard. I've read 40. It was a paper that came out of um, either the Lancet or Fertility and Sterility. Anyone, one of that they recommend now for level vitamin D levels to be above 40. So that's really hard. I mean, I work really hard. I take a lot of vitamin D,
Hmm.
um, and I'm just barely scraping like 50.
Yeah.
I take about 5,000 units a day, which is what we're recommending nowadays. 5,000 units of vitamin D, and I take that every single day, and I barely scratch 45, 50 every time I have it checked. So I'm not getting as much sun as I think I am. Number
Hmm.
one, I am out fairly often. I do play some golf, not enough. Um, and yet it's not enough. So,
Yeah.
definitely
Magnesium is also
supplementation is
important.
important.
That's another thing. It's important to not be deficient in magnesium because magnesium plays an important role of our absorption of D, which, obviously doing this, I learned, I was like, oh, that's interesting. People might be deficient in magnesium and be taking a lot of D, and then their body's not processing, which is why it's important sometimes even in foods. Foods have everything. So, like, even beef liver, from Chinese medicine perspective, is so
Sure.
beneficial because it has iron, but it has it in a combination of nutrients that helps the body absorb it.
Yeah.
Um,
B6, B12 are incredibly important for iron absorption as well. So all of these things
yeah,
are extremely important. Everything is all intertwined,
it
and we're just
is.
learning about this. For us, I've really gotten grabbed hold of this whole longevity thing. Hence my aura ring and all of this. And I'm just trying to apply a lot of the things that we know today work for longevity medicine and anti-aging principles
Yeah.
to the infertility world, because it's all intertwined. It's
Oh,
all intertwined.
without a doubt. It's funny because that you say that because I always say it. It's pretty much anti-aging.
Yeah, totally,
Yeah.
totally. They're even coming up with a way to stop menopause,
Oh,
which is
how?
extremely interesting. Believe it or not, recombinant anti-Mullerian hormone.
How is that? How explain that?
So the way that anti-Mullerian the function of anti-Mullerian hormone at the level of the ovary is that it stops follicular recruitment. That's why women with PCOS have higher AMHs, and therefore they have higher egg counts and higher. They tend to go into menopause later on, etc. That's because they have high levels of anti-Mullerian hormone. So by reproducing or creating it in the laboratory, and then from an early stage, this is in its infancy, by the way. Okay, so this is
It's new.
these yeah, this company, it's I believe she's a Harvard scientist, biochemist or something, who's coming up. My point is that, listen, that it's all intertwined.
Hmm.
Aging and even in menopause, for God's sakes. Like, now I've been doing this for so long that I now seeing menopausal patients who are like, listen, you took care of my baby, you're a reproductive endocrinologist, you understand the science. Will you treat me? And like, I realized, like, somewhere some women got like they got some bad luck thrown their way, because with the WHI results and the way they were interpreted, that made hormones bad. And somewhere along the way someone said it's okay for women to suffer from menopause, just suck it up. Like, it's not okay. That's not okay. That's not okay. And so if you start from very early on, and really practice what you preach, which is healthcare and not sick care, which is what we practice in the United States. We're just we're not proactive, we're reactive to when a patient is
Yeah,
sick, instead of early
absolutely.
intervention, early screening, and
Yeah.
all of that. And that goes for the infertility world, and that goes for a woman's long reproductive life extending past menopause. I think we still have a lot of challenges to overcome, but I think that we're heading in the right direction.
Yeah, for
Sorry to
sure.
digress a little bit.
Oh
I
no,
went
it's
off. I
okay.
went off on a tangent there for a second.
But you know what? I love the passion, and I love that ultimately is great. It's important, very important, because it's true, and I agree a lot with what you just said, that we should be proactive when it comes to healthcare. I mean, really, when it comes to so many things. And something else that I read. It was an animal study. It was a study on, I believe it was like, I don't remember which kind of animal it was. I think it was like either sheep or cows or some form of those, where they actually gave them oxytocin right before IUI, and that improved the chances of the conception rates, which I thought was very interesting, because I think that that's one of the things with IUI that's missing, because obviously you're taking away the connection that is usually there, or when you're just under natural circumstance. And I thought it was interesting because I was looking into it for something else to understand from a Chinese medicine perspective, because they have this heart uterus connection, that connection, the bonding, and so what I found was interesting too is that oxytocin increases around ovulation and after intercourse. And usually what they look at it as its role is usually for labor, not so
Yeah.
much conception. So I was just going to kind of like pick your brain on that. Any thoughts on that?
Well, I mean, oxytocin is secreted at the time of, I'm not sure of ovulation. I didn't know that, but
Or it
definitely at the time
increases
of,
around that time, like right before ovulation in the cycle, a woman's cycle.
um, well, we know that it's involved is at the time of orgasm.
Mm-hmm.
And so this make uterine contractility,
Mm-hmm.
which is what is used for in intrapartum, to promote contractility of the uterus, to promote descent and eventual delivery.
Mm-hmm.
And we know that it's intimately involved in orgasm. We're seen during intercourse and orgasm. And so with projection of with the secretion of oxytocin and it causing uterine contractility, obviously not at the same level that it does during labor, but at smaller amounts, then I can see how there could be a role for oxytocin in artificial insemination.
Or even infertility in general. And because it's got to be there for a reason, why would the body produce it around that time?
Well, yeah, I guess, but it's either IUI or IVF, and we definitely don't want oxytocin during IVF cycle,
Right, because you don't want to contract, right?
right? Because we're transferring an embryo where there should not be any oxytocin, and you can have the most beautiful embryo, but if you screw up the embryo transfer through no fault, just because it's a difficult transfer for a myriad of reasons, and you cause uterine contractility, then it's there's a high likelihood of pregnancy not occurring during that time.
Right. I think it would be an interesting thing to look into for IUI. There might be something to it, because if it works with animals, and the animals obviously have similar certain functions that we do, mammals,
Yeah.
that seems like an interesting thing.
I think there's not going to be a lot of not there's not going to be a lot of resources put into improving IUI. To be
Hmm.
honest with you,
Yeah.
IUI, I think we it is what it is, and I mean I think the majority of research is going to go to improving even more IVF rates, because I think ultimately patients are going to want to go more towards IVF, no matter how hard we try to say, "Hey, listen, there's this option or this option or this option."
Hmm.
It's more become a more of an instant gratification society. Number one, number
Yeah.
two, people are waiting longer, so therefore they're more pressed for time, if you will.
Hmm.
And I think there will be less of a motivation to go down a treatment option that, frankly, has a low pregnancy rate.
Right. And then my other question is, what are your thoughts about a lower intensity cycle, like like lower amounts of hormones for older women? In some
We use it
cases, I've
all.
heard it might be a
We
little
use it all the
better.
time.
Oh, you
Yeah, we use it all
do?
the time. I think
Yeah, yeah.
it's significant. A very successful option in cases with severely diminished ovarian reserve. I
Okay.
think that the senescent ovary does not do well with high impact medication or high doses of medication.
Mm-hmm.
Separately, jointly, the medication costs are exorbitant,
Mm-hmm.
and you end up having the same number of eggs that are mature that get fertilized with a mini stim protocol as you do with a high dose regimen.
Okay, so you've seen good success with that.
Well, I mean, not good success because generally these cases are we've seen success. Let's call it
Yeah.
that.
Okay.
Because the patients that you're treating with with this protocol are patients who are POI, premature ovarian insufficiency, diminished ovarian reserve, poor egg quality, high
Mm-hmm.
rate aneuploidy. So these are your poor responders essentially,
Mm-hmm. Mm-hmm.
and there are very specific factors that propel a woman to have success with this protocol compared to her twin sister with almost the same testing, who doesn't do as well.
Got it. And then lastly, we talked about this in the pre-talk. Let's talk about marijuana and sperm. That
I
is
have
showing. Yeah.
I don't do it myself, but I have no problem with people that do. What the data has shown that we're
Mm-hmm.
just becoming more and more familiar because the overwhelming number of people who are using cannabis and open about it, right? Which is the second part, which was very difficult to conduct studies because it was so people were ostracized, they were looked at not the wrong way and
Mm-hmm.
seen as in the fringe, and now it's so mainstream. But so now we're keenly aware of patients. We're able to analyze them, and what we know without a shadow of a doubt that the potency of the cannabis that's being produced these days is anywhere between 8 to 12 times more potent than, I think I used the joke of the guys at Woodstock back in the 60s, right?
Mm-hmm.
Where everybody was getting pregnant and everybody was high on life, all of those things. And then what we've also known, which I did mention, is that using the vape pens, the whatever types of inhalers, as opposed to the traditional joint, if you will, increase the potency of that by a factor of 2 to 3. The
Mm.
the 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 cannabis that was already potent to begin with.
Right.
So what you're seeing in males in particular, and I'm not sure that the literature is so complete on the female aspect, are that we're seeing a high levels of fragmentation. And what
Mm-hmm.
fragmentation is imagine that sperm is like an Amazon box. And inside that box, there's a porcelain doll that's wrapped in these packing cubes. They're held very, very tight. And under the best of circumstances, those packing cubes are wound so tight, packed so tight that nothing, if I kick the box off the Amazon truck, nothing is going to happen to the porcelain doll. Well, as fragmentation occurs, and it happens under natural conditions in old guys like me, uh, you know, patients who, occupational hazards, firefighters, exposed to toxins, a lot of the people who use fertilizers, et cetera, see high levels of fragmentation.
So you're talking about
Uh,
DNA fragmentation.
I'm
Yeah.
talking about DNA fragmentation.
Yeah.
And so what we're seeing is high levels of fragmentation at the level of the DNA of the sperm, which has significant effects on embryo quality,
Mm-hmm.
embryo development, and pregnancy rates, and high levels of aneuploidy, which is abnormal embryos. So, I'm not here to slap you on the wrist and say don't smoke weed, but really that's what you're facing. And we
Right.
know this, we know that this happens in women with cigarette smoking.
Mm-hmm.
Like this is a well-known cause of an accelerated transition to perimenopause. 65% of women who smoked a pack a day for greater than 15 years will go into menopause before the age of 40, assuming they started before their 20s. That's a pretty ominous number, actually.
Yeah.
Thankfully, not many women smoke these days, cigarettes anyway.
Mm-hmm.
So I guess the results of cannabis on females is yet to be elucidated, but we definitely have some pretty compelling evidence in terms of the male data that show that it can have detrimental or deleterious effects on sperm quality and not necessarily on numbers.
Right. Which is what people look at usually when I mean that's
Exactly.
like the analysis is always on numbers, shape, and
That's the
shape.
thesis and morphology.
Yeah, and morphology, and they won't necessarily look at the DNA fragmentation. That's actually not something that REIs
Is done
usually
in
initially look at.
well, not initially, unless there's comorbid situations or things that raise your red flags. For example, advanced paternal age, we always do it. Uh,
Right.
Particularly in egg donor cycles, right? Because patients will be like, "Well, I'm using an egg donor, and why don't I have bad embryos?" Well, because your husband could be 70
Yeah.
or 60, and then their fragmentation is completely elevated and through the roof. So yeah,
Right.
so
So
firefighters,
yeah, it's
occupational
important.
hazards,
It's important for people to hear this because they can go in and say, "Oh, the semen analysis was perfect,"
right?
but that, like what you just said, is not really checked. So they may not in a healthy like younger guy.
It's not as nuanced as we once thought it was.
Yeah, yeah, interesting. It's fun.
Yeah,
It's always fun for me to talk to REs. Just to get to pick your brain and get your thoughts. And you're my neighbor, so
that's
so
right.
it's pretty
And thank you
cool.
very much for the invitation. This was really fun.
Yeah,
It's we spoke about a wide array of different topics here, so this was
yeah.
really nice to connect this way.
Yeah, for sure. And I know that a lot of people are going to be like, oh, this is interesting information. Because I know that what you just mentioned, a lot of it is not common knowledge. People don't automatically hear about this or really know to think about asking about it. So I appreciate all your information, all your good data. And for people who would like to work with you or in town, how can they find more about you?
Well, we are at Conceptions, Florida. We have two offices in Merrick Park and Coral Gables, and one in Miramar, and hopefully soon also in Boca. And I'm there, Armando Hernandez-Rey, MD. I'm sure easy to find these days on Google. But I'm happy to help in any way that we can. We've been doing this for a long time, quite successfully, thankfully, and we take a lot of pride, humbly speaking, but proudly also, in having a good footprint in South Florida in the infertility world and trying to offer the best care possible.
Awesome. Well, this was such a pleasure. And thank you so much for
Thank
coming
you,
on
Michelle.
today. So that concludes today's episode. You can find all of the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to share and leave a review. Reviews mean everything to podcasters, and I really enjoy hearing from my listeners. You can also find me on my website at www.thewholesomelotus.com or email me at info@thewholesomelotus.com. I love hearing from my listeners. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com. I thank you so much for listening in and hope that you have a beautiful day.